Back pain is an important problem which is increasing day by day. Most of the reasons are sedentary lifestyle, sedentary work, sitting and working with computers, all the time sitting with the mobiles. These are some of the reasons apart from lack of exercise and aggressive sports and injuries. Now, spine is a very important structure in the body which is there in the back side that connects the brain and the body. The spinal cord contains millions of nerve fibers that come from the brain and reaches various parts of the body. And these nerves are protected by a series of bones starting from the neck all the way to the bottom. And these bones are interlocked with joints and held together by ligaments and supported to sit straight or walk straight by the muscles. Now, in between these bones, there is something called as a disc. It is something like a washer which makes the spine flexible. That is the reason why we are able to move the neck as well as the back. Now, the spine is the one that gives mobility as well as stability to the body. And at every point between the two vertebrae, the spinal nerves will come out that are connecting the body and the brain. Now, whenever there is a problem, either in the disc or in the bone or in the ligament or in the joint or any tumor that grows and compresses these nerves, can cause back pain, and also the pain that comes to the leg or the hands, it is called radicular pain. Now, the commonest cause of the back pain is the disc, and the disc is becoming very common, where sometimes it can happen due to injury, and smoking is one of the major risk factors. Those who smoke have a very high predilection for the disc prolapse. And whenever people are not used to lifting sudden weights, lack of exercise, decreased calcium or vitamin D deficiency and some other metabolic disorders are some of the causes for the disc prolapse. It usually presents with back pain, and also the pain coming down to the leg increases with walking or straining, relieves with rest. And some people can walk for a short distance and then they get numbness and tightness of the leg, and when they sit for 10 minutes it will all be relieved and they can again walk. That shows these nerves are not getting enough space in the spinal cord. The structures are compressing the nerve. The moment we relieve the compression, and it will settle down. The most important thing to avoid back pain is the regular exercise, proper diet, proper intake of calcium, and maintaining the body weight and the healthy muscles. So, they can maintain the stability of the spine by not compromising the mobility at the same time. Whenever there is a strain, a ligament tear or a disc prolapse, there will be immense back pain. There are other causes like age-related changes we call as spondylosis or degeneration, where with age bones undergo certain changes, joints will get worn out and they start rubbing the nerves and they cause the back pain. To greater extent, they can be managed with a good medication, exercises and good lifestyle, but if it is beyond, and if there is a compression of the nerve, then one may have to undergo a diagnostic test like MRI scan, and then if required surgery. Lot of people have myths about the spinal surgery. Spine surgery cannot be done, and once it is done, it is dangerous. It is not true. Sometimes if you don't do surgery, it can cause nerve damage. Their foot can become weak. They will not be able to wear the chappals and walk properly. They have to limp all the time. So, it is a proper diagnosis and proper selection and proper surgical treatment is the key, so that you protect the nerve and so that one can get back to the work as quickly as possible. Today, the spine surgery is advanced so much with microsurgery, endoscopic surgery, lot of intraoperative imaging gadgets. So, the spinal surgery has become absolutely safe, so that one will undergo surgery, they get discharged on third day and they do very well with good exercises after that. October is the World Spine Health Awareness Day. So, during this time we try to advocate the spinal health for every individuals, particularly for the adolescents and the people who work in the bench work like software and others, and they need to have good mobility, good exercises, good diet and avoid smoking, and good lifestyle can maintain the back health very well.